left side.
Yes.
Okay, how are you feeling about that?
Very good.
Yeah.
Very calm because I'm here. How else would I feel? Yeah. I actually did.
Yeah.
So I bet you've never seen a patient so excited to have a filling before. This is called the enjoyable dentistry technique. It uses happy air, known as laughing gas. We also take you through a guided meditation. So this patient had a leaking filling on his molar tooth. So after making the tooth numb with an almost completely painless injection, a rubber dam is really important, and it helps to isolate the tooth and allows us a nice clean field to work with. Any water that comes from the drill will not go down the patient's throat. There's no risk of them choking on it. And also when we come to placing the filling, the field is nice and dry. The best way to place composite fillings is in a completely dry environment. So we remove the old filling with the drill so that we can get down to the bottom where the decay is. And we like to show the decay up with a pink dye. This is called Caries detector dye. Once the tooth is nice and clean and there's no more tooth decay left, we start to prepare the tooth for the filling. After roughening the surface with acid, we place a glue on the surface of the tooth, which is called bond, which is the interface between the tooth and the filling. Then we start to place the filling, and again there's a really specific protocol to allow us to place the filling so that it doesn't stress the tooth and what's left of the tooth underneath. We really like to take our time placing these fillings in a very artistic and sympathetic way. It's not about just stuffing the filling in and pushing it down. We want to recreate the original contours of the tooth so that it functions exactly how it needs to. All of these steps help to ensure that the filling will last as long as possible. Make sure that it feels smooth and there's no areas that can trap extra plaque and bacteria. We use something called a white stone for this. Once we've finished, we allow the patient to breathe in pure oxygen for 5 to 10 minutes. This brings them right back down to earth. At this stage, we check the bite, make sure that you're happy, and adjust it if necessary.